Altered Physiology, Mechanisms of Disease 2. This is a continuation of our lecture series on the cardiovascular system. In particular, we have been looking at valvular disorders, myocardial infarction, heart failure, and heart transplant. In this episode, we will explore some of the modifying risk factors when it comes to the intersection of heart failure and diabetes. On this first slide, what we're looking at is the Framingham Heart Study. Framingham is known for being a longitudinal study in the United States that has followed thousands and thousands of individuals over several decades. And in this particular slide, what is most evident is we are looking at the risk ratio for those individuals who have diabetes over a 30-year follow-up period. And in particular, we're looking at risk of various types of cardiovascular disease events by age and sex. And what we can see here is that anytime you have a risk ratio above 1, it indicates that the individual is at increased risk. So for example, if we're looking at total cardiovascular disease, for women, the relative risk would be 4, so they're 4 times greater to have cardiovascular disease if they have diabetes. Now, most importantly, what you can see on this particular slide is that the risk ratio for both men and particularly for women is particularly high for patients who have diabetes, and they will go on to have heart failure. So they have a relative risk for females of close to 10 and a relative or a risk ratio of 6 for males. That is exceptionally high and just shows you the linkage and dominant outcome for people with diabetes is in fact heart failure. So now if we look at the next slide, what you can see is that there are a number of clinical trials that have looked at the use of glucose-lowering agents in patients with diabetes to try to improve their glycemic control. And so you can see the various types of drugs shown at the bottom of your screen, and that's not particularly important. One such example they have is insulin. Another one would be sodium glucose transporter 2 inhibitors, SGLT2 inhibitors. We're not worried about the particular drug, but what you can see here is when an effort is made to lower glucose and improve glycemic control, that in fact you do have a much lower risk. So it's much closer to 1, which is the risk of the standard population. For those individuals who are on diabetes medications, and may be at an increased risk of heart failure. So in this case, it would appear that simply taking glucose lowering medication almost, but not fully, but almost normalizes their risk for heart failure. Now on this next slide, we're looking at the use of SGLT2 inhibitors on heart failure risk in patients with diabetes. And what you can see here is that this was a large study. They randomized and treated over 7,000 patients, and the patients were either given placebo or a type of SGLT2 inhibitor, either 10 milligrams or 25 milligrams. And to be included in the study, you had to be an adult with type 2 diabetes and established cardiovascular disease. So a very low proportion actually had heart failure at baseline. They were under a BMI of 45, which still means that they could be overweight or obese. They had glycemic control measured by their A1C between 7 and 10%, and they had normal kidney function. So looking at their glomerular filtration rate, it was above 30 milliliters per minute per um, meter square. So um, this was a fairly wide heterogeneous group, but once again, they were allocated to one of three treatments, either placebo or 10 milligrams or 25 milligrams of this SGLT2 inhibitor drug, which acts for improving glycemic control. And what you can see here is when we look at various outcomes, a 3-point MACE score is kind of a composite score representative of major adverse cardiovascular events, such as heart attack. Or if we break it out into the individual variables, cardiovascular death, non-fatal heart attack, or non-fatal stroke, what you can see here is that individuals who were taking the drug treatment, this SGLT2 inhibitor, tended to have reduced risk. And we can look at that and determine that from this screen by looking at the hazard ratio, or the HR. And so anytime that dips below 1, it suggests that there is a reduced risk for that particular outcome. So if we're looking at the 3-point MACE score, once again, which is just a score representing major adverse cardiac events. And if we look at cardiovascular deaths specifically, individuals on the drug had a significant risk reduction. You can see the p-values of less than 0.05, which supports the fact that it is a significant reduction. Now, there was a slight decline. So for individuals taking the drug, they did have a slight decline in their risk for non-fatal heart attack. However, if you look at the p-value, it's much greater, or higher than 0.05, and therefore we could say it's non-significant. So they had a non-significant decline in non-fatal heart attacks. Interestingly enough, for non-fatal stroke, there was actually a slight increase in one's risk when taking that medication. However, it was a non-significant increase. So it could just be due to random chance or occurrence that happened. Now, here once again, you can see the benefit of taking these glucose lowering agents, or to improve glycemic control in patients with diabetes and on heart failure outcomes over a 48-month period of time. So over a 4-year period of time, you still see that there's a benefit in that patients were less likely to have an event such as a heart attack, for example, if they were taking the drug versus if they were taking a placebo. And so this just further breaks down the data. So once again, looking at the risk of heart failure related hospitalization or cardiovascular death, once again, you started to see somewhat of a decline as you started to see somewhat of a decline in cardiovascular death and somewhat of a decline in heart failure hospitalization. By and large, this study would suggest that there is beneficial outcomes when individuals with type 2 diabetes are taking drugs to try to improve their glycemic control and inadvertently lowering their risk for heart failure outcomes as listed on the screen here. And so that concludes this lecture episode.